Ladies and gents, you might not know it, but Sweden stops testing for coronavirus people who are outside of the emergency rooms and for people who are not in hospitals right now. So if you are experiencing symptoms or if you have been in so-called red zones or hot zones with high concentration of virus, or even if you have both, even if you have been to the so-called red zone and at the same time have all experiences of the coronavirus, it's still not enough. You will not get tested because Sweden has stopped testing people who are outside of the hospitals already. And now I'm going to prove it to you by going to the official site of the Stockholm region. So, as all of you can see, this is Stockholm region's website, Region of Stockholm. It is the guide to the healthcare system. And as you can see, it says situation in Stockholm just now or right now. And the text says following. The testing is going to be concentrated when it comes to coronavirus in the region of Stockholm to those who are already hospitalized in different hospitals with symptoms that remind of coronavirus. That is to protect patients that are in hospitals and already have other diseases. People who will not be tested are the people who just have the symptoms. Even if you have been in an area which earlier has been a hotspot for the virus, or if you have had close contact with somebody who is sick in COVID-19, you still will not get tested. So, since the people who will be tested will be a lot fewer, there is also change in the routine how this number of people who are sick is reported. It's not gonna be updated in the same manner as it used to be before. Thus, as you can imagine, Sweden is having great, absolutely awesome statistics when it comes to coronavirus. And you know why? Simply because we are not testing anymore people who are outside of hospitals. For example, if you have developed your symptoms at first and then you were at home very quickly, getting sick, you didn't have enough time to go to a hospital. You just die. Well then, why should they spend a whole virus testing kit on you if you're already dead? And thus your statistic improves, don't you think? It's a great way of handling it. And yes, I know, there have been some reports of horrible cases in Italy where doctors have been forced to choose between those patients who should be allowed to have a machine where they help their lungs to breathe, and some other patients who were told that they will not get this machine, and a lot of those people died afterwards. And yes, it's a horrible decision, and I don't envy anyone who is in this position to decide who will have to say, this person lives, this person dies. But at least those people are past the first stage. At least they will get to know that they have the virus. In many, many cases in Sweden, now you will not get to know if you have the virus or not because the testing for virus has been stopped.